what we've discovered about pumping cerebral blood flow and how all that plays out in the brain. And this is going to be a big thing. It's going to be a very big deal on terms of neurophysiology and clinical interventions for people, because so many people that we're trying to treat with neuromodulation and neurofeedback and stuff are really probably just really dealing with poor circulation of cerebral spinal fluid, and it's basically their neurons are bathing in dirty water. So let's go on. So this is called the glia lymphatic system, or glymphatic system. I just need to reduce this screen. I don't know if I want to close it. It might do something nasty, but it's a pretty big window. Dock control panel to screen. What will that do to me? I don't know. Can I actually reduce the sidebar? It's quite large. Oh, hey.
Yeah.
People
This
can
is a
see
little
you.
arrow.
I'll stop sharing my webcam then. People don't, or do they want to see me? I could do that if they want. Doesn't matter either way. Okay, oh, here's the arrow. Here's the arrow. I got it. Got it. Okay, perfect. Oh yeah, now we're talking. Okay, so yeah, hi again, everyone. So yes, we're talking about the glia lymphatic system, which was only discovered about 12 years ago. And so it's called the glymphatic system is the name that it was given. And basically, it's the cleaning system that cleans up the debris from daytime metabolites while building up tau proteins and all kinds of wastes from neurometabolism, and dumps it into the veins. And then from the veins, it gets it into the lymph system, and then it gets cleared out into the kidneys, and we pee it out. And this is basically how the system works. So there's cerebral spinal fluid coming from the subarachnoid space, and the astrocytes get activated during deep sleep, during delta waves activate, large delta waves, I should say, proper sleep delta waves activate the astrocytes to carry these waste products into the veins, into the space actually, between the veins and the brain, and they put into this perivenous space, and then from there it gets carried down into it absorbs into the veins and gets carried into the lymph nodes and gets disposed of. So that's how we get rid of waste, but it happens during deep sleep, and of course this is going to play out, as we will see shortly here, in a very big way. Okay, so how do I go to the next slide, guys?
Use your arrow keys. Use your right arrow.
I just had to click on it. Okay, yeah, here we go. So there's a few ways that this happens, and this is one way here. And this has to do with norepinephrine that occurs during low wave or slow wave sleep. And every time there's a pulse, we get a norepinephrine spike, and it causes the arteries to dilate and constrict, and arteries dilate and constrict, and dilate and constrict. And every time they do that, the waste products get pushed into the veins, into the glymphatic system, and disposed of. So this is kind of one of the ways that they have found that the system works. So here they have to say tightly synchronized oscillations in norepinephrine, cerebral blood volume, and spinal fluid as the strongest predictors of glymphatic clearance during non-REM sleep. Furthermore, stimulation of arterial oscillations enhance CSF inflow, demonstrating that vasomotion acts as a pump, driving cerebral spinal fluid into the brain. So clean stuff into the brain and dirty stuff out. But look at this, Ambien, the sleep aid Ambien suppresses norepinephrine oscillations and glymphatic flow, highlighting the critical role of norepinephrine-driven vascular dynamics in brain clearance. So they have found that Ambien actually can turn into, can help bring on issues like Parkinson's and Alzheimer's over time. Not a good drug to take. So here's an example here. We got the internal carotid artery, the internal jugular vein. There's pulses, so there's dilating and there's constriction on the return side of the pulse. And every time we get dilation, we get cerebral blood volume increase, right there. We get cerebrospinal fluid movement, a little delayed. And then we see the cerebral blood flow change at the interjugular vein, right here, internal jugular vein, sorry. So this is how this process plays out. And it's pumping it, but it's also pumping it typically in tune with large delta waves. And that's going to be an important part of this. So here we go. So this is a schematic of the current model of the glymphatic system. We've got altered permeability here in the brain. We've got neuroinflammation. That's another problem. And there was a really good release recently that came out of Fred Schaefer wrote a very good article about spindling beta and how it reflects neuroinflammation. So you might want to read that article. I do have a copy of it. Because we see a lot of spindling beta, and I don't think I've ever really, we've always known it's been an issue, but I've never really correlated it with neuroinflammation. So that was new learning for me. We've got the AQP4 polymorphisms, which is a genetic, and we got aging. So all these factors influence how well we are going to have glymphatic flow. Asteroids are the main players in all of this. And if everything works right, by the way, up-regulating factors, exercise, sleep, and lifestyle choices, good nutrition, and so on, improve glymphatic flow. And the astrocytes are the main player in this, and they are taking gathering up all the metabolites, the waste from neuronal activity, and they're dumping it into these receptors, into the veins for disposal. And it goes down into the cerebral spinal fluid down here and a lot of it gets dumped through the fourth ventricle in the brainstem and goes down the spinal cord and then permeates out there. But there's other ways of getting rid of it too, like the internal jugular vein is one way. There's also a nasal way of doing this as well. I'll show you in a bit. Should have had that. Where did I put that slide? Okay, I'll get to it. Okay, so sleep deprivation. Sleep is a big factor. If we don't sleep well, we have reduced cerebral blood flow, we have reduced focus, memory, with increasing depression, obesity, and risk of Alzheimer's disease. Those with what I call diffuse axonal TBIs, I kind of call it different things nowadays. Now I'm calling it really a thalamocortical disconnect. They suffer from very poor sleep. Those with Alzheimer's suffer from very poor sleep. Those with Parkinson suffer from very poor sleep. Those with chronic traumatic encephalopathy really struggle with poor sleep. So sleep is a big factor in how the system pumps. Impaired sleep appears to precede the onset of cognitive symptoms in patients with Alzheimer's, and a strong association exists between disrupted sleep and the development of Alzheimer's. We can conclude that cerebrospinal fluid beta tau proteins, the level and the degree of that, this diurnal oscillations are predictive of amyloid plaque deposition and are associated with sleep disruption. In traumatic dystrophy and traumatic encephalopathy, which we look at quite a bit, acquired amyloid and tau pathology, sleep disturbances are also commonly reported in the acute phase, as well as several years out from the injury. Okay, a well-described early feature of human Alzheimer's pathogenesis is degeneration of the locus coeruleus. That's norepinephrine, which we just talked about earlier. So we lose our norepinephrine, we're not going to get that pumping action that helps get rid of the plaques. So here's a little study here. Now this is interesting. So what happens if your spouse has dementia? So this study looked at that to see if dementia is contagious, so to speak. And so they looked at this. So these are spouses of persons with dementia, and they're in northern Utah when they did the study. Looked at 2,442 subjects, 1,200 married couples, age 65 and older. They looked at incident dementia that was diagnosed in 255 of the subjects, with onset defined as age when subject met DSM-R or DSM-3R criteria for dementia. And what they found is the subject whose spouse experienced incident dementia onset had a 6-fold increase in the hazard for developing dementia themselves. And that's just because they're waking up in the nighttime because they have all kinds of issues with their spouse who is not functioning well and getting up in the night, and you never know what they're going to do if they have dementia. And as a result, the caregiver ends up with a 6-fold increase in developing dementia as well. Okay. Now the E4LL, which is considered the Alzheimer's gene, there's plenty of roles on, or plenty of research on that, but most of the research on that E4LL shows that the primary symptom of this gene is sleep disturbance. So it might not be that it directly affects Alzheimer's at all, but it's an indirect correlation to Alzheimer's because people with this gene don't sleep well, right? And when they could take people with this gene and they can teach them ways to sleep better, and there's lots of ways we can do that, they have a tendency to do better than people who don't learn techniques for improving their sleep. Okay, here we go. So this is Alzheimer's here, dimension. Now this is measured with dynamic PET. Now this is another way that the brain disposes of dirty cerebral spinal fluid, or circulates it and cleans it. And this happens to be an olfactory system that has been discovered. And you can see where that is. Well, look at all the people who are post-COVID. How much of this could actually be that the system in the nose no longer is cleaning those neurons or cleaning the fluid around those neurons, and they're getting toxic, and that's why we can't smell. Back in December, when I first developed my CSF pumping session based on the research that we had read, and I'll show you that research in a bit here. After the second session of pumping cerebral spinal fluid, I mean, I got to back up a little bit, I'm sorry. A year before that, I lost my entire sense of smell. I could not smell anything after I had a severe, well, we don't really know if it was COVID or not, but I had a bad cold for a good 8 weeks. And I lost my entire sense of smell, and it was a little frustrating. I wish I could have smelled, but anyway, in December, when I developed the first session, I ran it twice, had a fair chunk of smell back. And since then, I've used the pumping session, the CSF pumping session now, a good 30 times, and I've got my entire sense of smell, probably after the 6th, 7th time, but I'm just using it anyway because I'm experimenting and stuff. So there might be something really important about treating, say, post-COVID with entrainment, with the pumping entrainment to make this work. Here's another example of reduced CSF fluid motion in patients with Parkinson's. And with Parkinson's, when we look at the flow through the 4th ventricle, it's impaired compared to controls. Controls have better flow than Parkinson's patients do. And the same thing has been done with Alzheimer's as well, and so on. So we're going to look at entrainment now. And entrainment does a lot of things in the brain, just so much stuff. And, the more I look at neuromodulation, whether it's entrainment or TDCS or anything else, magnetic stim and so on, when I look at an EEG and I see a signature on an EEG, I don't think to myself in terms of, well, we should just do neurofeedback or something to change that EEG. The question that comes to mind is, what is causing that EEG? Because I'm finding 9 times out of 10, it's other factors that are causing an EEG signature. And we shouldn't just be trying to force or get a person to force their EEG to change. We should be looking upstream and finding out what is causing that EEG and fix that, because that'll affect the whole body. If there's issues going on, the entire body is affected, and it could affect our health in all kinds of ways. So we should really go upstream, maybe see orthomolecular medical doctor, and take a really, really good look at what's going on in our bodies before we proceed with neuromodulation or anything. So that's just my thought. So entrainment, well, we know that entrainment can adjust the brainwave frequency just based on the frequency of the stimulation. We've seen that before. We can put people who are having adrenal problems from extreme stress and they're ruminating on things 24/7. Now we can dissociate them in a meditative way and give them several hours of break, at which time their adrenals get a chance to recover. And we use this a lot with military and first responders just for those reasons. Autonomic calming, and we say break the HPA-Axis, the hypothalamic pituitary adrenal axis, primarily the pituitary, because during long-term chronic stress and or physical, if you're very, very physically active and too active physically, but mostly it's stress, you will fatigue the pituitary, and it loses its ability to make ACTH, adrenocorticotropic hormone, and it cannot activate the adrenals to release cortisol so we can function properly. And then we're exhausted, we're depressed, we're fatigued. The liver doesn't work right, the pancreas doesn't work right, the kidneys don't work right, the brain doesn't work right. So having a healthy HPA-Axis is crucial to feeling alive and functioning well. And entrainment will help break people who are going through trauma and PTSD. It helps break that thought process so they get a chance to recover their HPA-Axis. Entrainment increases cerebral blood flow, lactate and anaerobic ATP. It balances neurotransmitters. It does neuronal excitation and glia, and visual evoked potential studies are showing this. Increases heat shock protein, which is a protective protein in the body in general, but it's definitely in the brain. Helps protect the brain. Activates specific non-inflammatory cytokines. Has direct effects on neuronal stimuli. And the last one, what we're going to look at today, is number 10. Increases cerebral spinal fluid circulation through the glymphatic system. Okay, so we're going to talk a little bit about the thalamocortical disconnect, which I've been working on for many years now, and how it plays out. This is low voltage fast in some or sometimes even all the channels on an EEG. Typically see theta right down the midline, the cingulate, and we see also phase issues, mostly in beta bands. And there's clinical biomarkers are endless anxiety, severe insomnia, and all of them are obsessive compulsive because of that theta down the cingulate. They can't turn off the cingulate, and it just kind of runs, has no brakes. And so basically my population are hoarders, counters, cutters, ritualists, door closers, knockers, tappers, anorexics, and committed substance abusers. And I've seen them all, and they all have a similar brain pattern. And I'm going to show you just one case. Now, this is one of my most severe cases. And this fellow was 31 years old when he came to see me. And yeah, he was having a lot of trouble. Basically, he was living in a basement suite that a friend of mine had set up for him because they were friends, and really low rent. This guy cognitively was really struggling. He barely passed high school, didn't have a trade. Socially was really reclusive, and socializing, requires a fair bit of, you're going to be pretty sharp cognitively to socialize because social cues are fleeting and they're quick. And anyway, this guy, so he was a social recluse. He was great. He was 6 years old when this happened, and now he's 31, and he's still struggling. He did odd jobs like helping people move furniture, make enough money to pay some food and alcohol because he was a binge drinker. So, and when I had him on intake, he didn't even remember that he had this severe accident when he was a child, where he fell off a slide and punctured his right temporal area an inch. And he was the first person in his little town in Alberta here who was put on the air back and sent to the city here at the University Hospital for treatment. Anyway, you can see here lots of trouble. Lost his license from a DUI in 2013. Then he was in a treatment center. Then he was kicked out because he was drinking in rehab. I mean, yeah, when your brain is just going wildly crazy, those are the kinds of things that happen. And anyway, his friend sent him to see me. So this is his eyes closed EEG. Now, when I do an eyes closed EEG, I really, really try to make it alpha productive or alpha conducive. And so I put him in a big reclining chair. It's very comfy. The room is dim. I have a fan that runs to make white noise. I Give them a footstool, give them a blanket. I mean, I want them to be able to make alpha for sure. And if they absolutely just cannot make alpha, or in many cases they'll make alpha on some channels but not on other channels, then it's easy to tell, where the problem areas are. But in this, when it's an entire brain, then it's a little trickier. You have to really make sure that environment is alpha conducive environment, or if it's too much light, or they're uncomfortable, or they're thinking stuff. So I never tell them. I mean, these are all OCD, these people. So I never tell them to relax their jaw. If I do that, they'll start saying, relax my jaw, relax my jaw, relax my jaw, relax my jaw in their head. They'll be thinking like mad. And I've learned that I cannot say even just to relax their jaw. All I can do is make them very comfortable and sit and wait 10, 15, 20 minutes until they relax their jaw naturally. And then I will start recording after that point. Anyway, you can see here, no alpha, none at all. He's gone. And so he can't make alpha waves. And delta waves are hyperpolarized alpha waves. So if you can't make alpha waves, you can't make delta waves. Okay. I'm not sure why this slide is here again, but just to remind us of all the things, I guess, that entrainment does. Anyway, so he did entrainment. And after 30 minutes of entrainment, he's putting out massive alpha spindles interlaced with delta activity. I see this a lot with most people. They fall asleep, and first they will see the alpha start growing. Usually in the parietal area, the alpha will start to grow in the parietal areas and spread across the brain. And they fall asleep, and so they make big bursts of delta and then bursts of alpha. Usually the alpha is a little bit fast, believe it or not. But I have found that alpha entrainment does not work, because we're not really working with an entrainment issue. We are working with cerebral spinal fluid, blood flow, and everything else. And the entrainment the actual entrainment aspect of AVE is really not very important. A variety of frequencies can do this. And in fact, I used an alpha beta blend in this case, which is our mood booster protocol, but I often use the SMR beta blends to generate alpha. So we know we're not working on a frequency following response when we do this. It's working on other factors in the brain that are getting the thalamocortical network to kick back in again and start generating alpha waves. So here he is 15 minutes post, and he's still sound asleep. We can see here before, this is what he looked like. Lots and lots of delta, as you can see. And it typically, if I zoomed out a little bit, we'd see a lot of it is centered around the cingulate as well. That'll be the strongest point usually in the delta or theta. This guy was delta. Most people are in theta, but this guy was severe. And so here he is now. Now we see it sped up. We still see it. He's still, this is microvolts. I threw you off a little bit. This one here is standard deviations, and I should fix that so they're the same. So they're on the same measurements scale, right? Anyway, this is his microvolts now, and we see him now actually generating alpha, and it's fast. And they often will be fast for a week or two before it slows down to 10 hertz. Don't know why, but it's pretty interesting. So he slept for 30 minutes after entrainment had ended. And I don't know if I can even really call it entirely entrainment. I call it rave, because when we do that alpha, this was an alpha beta blend, but we do the SMR beta blends. We now randomize them mildly up to plus minus 1 hertz and anything in between. And we now call this rave, so randomized audiovisual entrainment. It's still entrainment-ish, but it's randomized mildly. And we find if we randomize it too much, it quits working. So it does need to have a frequency that's reasonably consistent, or it stops working. But rave works better than just AVE alone. And so we use that now on all our modern stuff with our, like in our Premier device. It's all the sessions are rave nowadays. Anyway, he slept 11 hours that night, which is a lot better than the 3 hours he used to sleep. And he continued sleeping well. He had reduced anxiety as well. This is a 9-day follow-up when I saw him, and he had no cravings in that 9-day period. He had no anxiety. He was rested and grounded. He was sharp mentally. He quit drinking. I saw him in October, and January he quit drinking entirely. 5 years out, still not drinking. He couldn't hold the job before. And this was him 3 years later. So once we booted up his brain, which took about 3 months, so they have to take the machine home and use it at home every morning is when we usually like them to use it. Sometimes they also use it at night. And we can see here, beautiful alpha waves where they belong 3 years later. In fact, here is the pre-treatment. This is microvolts now I'm looking at here. And we see him down there and there's nothing else going on. Now here is his alpha waves right here. They're a little slow, but they're happening. This is 3 years later. And so he's now functional. And here he is, clean and serene for multiple years of recovery. So very, very proud of himself. Yes, because he was really a struggling binge alcoholic prior to that. And that's all it was. We just needed to give him a little light and sound stimulation and we had him fixed right up. Okay, so how does this work? Have a little sip of tea here. Now, I didn't actually give him the official pump, the cerebral spinal fluid pumping session, but they all have a tendency to pump to some degree, just that when we do the pumping session, it pumps a whole lot more and a lot faster. And for more extreme cases like Parkinson's and Alzheimer's, I think it's going to be the way to go. So this is a study here that was done way back in, well, not way back, but by Williams in 2023. And they use all kinds of different frequencies, and they use a visual checkerboard pattern. And they even had more frequencies, I believe, than this. But anyway, this is what they found. So they did 2 experiments. I'm just going to, I think, show you the one of them. They did 3 experiments, sorry. They looked at the neural, hemodynamic, and CSF signals during visual stimulation using simultaneous EEG and fMRI at high temporal resolution. And then they kind of repeated stuff again with fMRI to replicate the findings, just to make sure everything was good and there were no errors being made, okay? So here we go. Here's a visual stimuli on and off. Now, they tried all kinds of different periods here, which I may or may not be showing you, I'm not sure. And they tried like 2 seconds on and off, 4, 8, 16, 30. And they found that 16 seconds of visual stimulation on and then 16 seconds off was indeed the very best approach for stimulating the circulation of cerebral spinal fluid. And you'll see why in a moment. 1 second. Hope I'm not catching my grandson's cold or flu or whatever he's got. He's been very sick. He's been staying with us the last few days. So now here we go. So B, here they're looking at the volume position for cerebral spinal fluid inflow detection. So they're looking at it in the 4th ventricle right here to see how much fluid there is moving of cerebral spinal fluid. Here they're looking at the bold response, so blood oxygen level dependent response to visual stimulation. And then of course the visual stimulation, we're seeing a fair bit in the occipital cortex, although other studies have shown that it can be all over the brain as well. This one, I don't know why they just only saw it there, but that's what they did. So here they are looking at it right in here, and they're showing that when the stimulation is on, and now it's gonna be a little tricky. Well, I'll get this straight for you. Just give me a second here. When it's on, and of course the arteries are all dilating, they're forcing cerebral spinal fluid. And when the, here we go, here's my cursor. So, and when the stimuli shuts off, the arteries constrict and cerebral spinal fluid now rushes back in. And it has to do this to balance intracranial pressure. So just by dilating and constricting the arteries, or letting them to, go back to the standard tone, will cause the cerebral spinal fluid to pump in and out as the brain maintains intracranial pressure. Experiment number 2, looking at similar things again, and so on with number 3 as well, and they're replicating basically number 1. Okay, and here's a write-up on it. Now this is a little bit more interesting, this one here. So here we've got across stimulus durations 2, 5, 1, 2, 4, or 0.2, sorry, 0.5, 1, 2, and 4. And they even got up to 15 seconds. And we can see here how the how the blood flow is increasing over time. And then when they shut off the stimulation, it goes back down. Cerebral spinal fluid, similar idea. Here's the outflow, here's the inflow, right? The bold across stimulus frequencies, and the frequency match. They felt that 4, which is here, wasn't quite as good as the 8, 12, and 40. So when we've designed our sessions, we have based them on 8, 12, and 40. I don't have one based on 4, although I could make one. But anyway, that's the way I did it. And here they're looking at, so this is cerebral blood flow right here. And you can see how it picks up, and it pretty much peaks at about 15, 16 seconds. And then they shut off the stimuli, then it drops. And when it drops, when it's peaking, cerebral blood flows, or cerebral spinal fluid is being pumped out. And when it plunges, cerebral spinal fluid is being pumped in. What they found is that in the course of 1 minute, so 15 seconds, they were using 16 seconds, I use 15, but I'll use 15 because that's what I would designed our sessions. 15 seconds on, 15 seconds off, 15 seconds on, 15 seconds off. So in 1 minute, every time you do a cycle, you get about 10% pumping of cerebral spinal fluid. And you can see that right in here. And if you do that twice a minute, you get 20% pumping action of cerebral spinal fluid. So you can cause a lot of stuff to clean up fast. And we're probably not just getting it in the fourth ventricle, but we're probably also getting it, through the olfactory system as well, since it seems to be working well for people who've lost their smell after COVID. And I've also got a client who has not had the sense of smell for 15 years. He lost it about 5 years before his Parkinson's symptoms really started to show, which is very common in Parkinson's, to lose your sense of smell for a few years prior to motor symptoms starting to show. Anyway, he's pretty excited. I'll tell you a little more about him a bit later. Okay, so anyway, you can read this later. I already explained it all to you. And this was a fascinating discovery. What's interesting, they just did this as a proof of concept. They didn't connect the clinical dots to this at all that I could find. But when I read this, like, holy goodness me, these guys are onto something big and they're not even aware of it. Anyway, so there you go. I'm just going to let you read this. You can always pause it later and go through it. Meanwhile, I'm going to move on. So here's a study that was done in 2002 by Tom Budzinski and Leslie Sherlin. They had a 10-stage, I can have a little sip of tea here. They had a 10-station multiple system that we had made, and they were using it in 2 seniors' homes, and they were doing a study on age-related cognitive decline. But a lady with rapidly progressing Alzheimer's, she was only 57-year-old female, you can see that here, and she was in pretty rough shape, and she was in the seniors' home, and she wasn't given much time to live. I think they said 6 months. And so they threw on the study. They did a bunch of Loretta's and good QEEG stuff as well, and but here's the kicker. So Tom asked me to do this. Are our old devices, our old Paradise devices, and we could make modules up to about 110 modules. I think we had that we could use to put into a session, which is a lot of modules. Nowadays with our Premier, we could put 1,000 in, I think, or 800 anyway. I can put it a lot in, which I do sometimes. But anyway, Tom thought if we activated the orienting response, that he'd have effectiveness based on the orienting response being activated. I'm not sure where he decided that was a good approach or not, but what he did do is he had me develop, say, I think it was 110 modules, and I had to go fast and slow and bright, like full on bright, and then off for intensity, loud and quiet for sound. And sound, I'm sure, will have an effect, not just visuals, but I'm sure sound does too. Although I don't think a study's been done on the sounds affecting cerebral spinal fluid. But when you see people using drums and all kinds of music to clear up brain issues, it's very possible that sound is actually causing increased circulation of cerebral spinal fluid and music in particular, but maybe any sound will. Anyway, so he was randomizing it from 9 to 22 hertz, bright, dim, like I say, loud, quiet. And we were doing these pseudo-random segments anywhere, it's typically between about 5 seconds and 20, 25 seconds. And so it was bright and dim, brightened off, brightened off, brightened off many times throughout that 30-minute protocol. And I have a feeling we were pumping cerebral spinal fluid the whole time and we never knew what we were doing. It was just dumb luck. Anyway, here's what's happened. So she was given the pseudo-random entrainment. It was 30 minutes. They did 30 sessions. So they did a baseline, which we're going to call Q1. After 30 sessions of entrainment, 12 weeks, so about 3 times a week. Q2, after 6 months. Now, after Q2, she moved home again because she was so functional. She didn't have to be at the senior center anymore, and she moved home. But she would come back occasionally, and she would get boosters, and that's your Q3. And then she didn't come back anymore after 6 months, but they did a 10-month QE on her anyway, and they had her come in and so on. So intermittently between Q2 and Q3, and none again, and none at all between Q3 and Q4. Okay, so they looked at Loretta's and so on, and they found decreased delta at T4 in particular during stimulation, 15 minutes post and after the 30 AVE session treatment 12 weeks later. And it continued to show decreased delta in the right temporal lobe, although you'll see it's actually global brain. It went down everywhere, and Loretta showed improved superior temporal gyrus and primary auditory cortex 15 minutes after entrainment and after the 30 session treatment period. So here we go. We're going to look at a Loretta here. So Q2 after the 30 sessions, very strong improvements, mostly in that right temporal area. At Q3 after 6 months, we're seeing not only is it down the right side, but it's also showing up in the left side as well. And after 6 to 10 months, the brain kept, even though she hadn't used it now for 4 months, the improvements still kept occurring. And this is what we've observed all the time. And I think Richard could probably testify to this as well using entrainment, that or other neuromodulation techniques. Once the brain starts to get booted up and starts to function, it'll continue to self-improve once it gets its functionality back. And maybe Richard can add a comment or two a little later here.
And Dave, just to give you a heads up, we're at about 12 minutes to the hour.
Okay, we're pretty close. Almost done. Okay, thank you. So all these people that I've looked at, and I showed you that alcoholic case there, he had no delta activity, no thalamocortical loops were going on, no rhythms. And this lady, the same thing, high delta, like we saw with that alcoholic, and no alpha. Well, how can the brain run without a drummer? It just can't play good music at all. After, look at this, she had a nice alpha peak right there. So that was important, okay? And to see that. So anyway, they concluded that entrainment seems to restore some degree of spatial ability. Following AVE, she was able to accurately find her way around a several block radius, including the distance from her home to the site of the training in the senior center. Her walking style improved from the shuffling, flat-footed stride of Alzheimer's patients to a normal gait. She reported that the cognitive fog lifted, and her microcog reasoning calculation was improved. But imagine being able to walk again through downtown Seattle and not get lost. That's pretty impressive. So here we go. That's it. Thanks for attending my lecture. Click this down and we can take some questions now.
Richard will take a moment just to unmute everybody.
Sure.
But
how do I
great
turn
presentation.
off
I'm just curious. This is just sort of a theoretical one based on everything you've talked about. If you could only have one frequency with AVE to help improve your brain, what would you choose?
Generally speaking, SMR is probably pretty much the best frequency in the 12 to 15 hertz range. When it comes to this pumping action, I personally like the SMR pump. But I know some people who've tried the SMR and the gamma, and they have really liked the gamma one a whole lot better. And some have liked the SMR a whole lot better. So I'm going to say those are my top 3 sessions, generally speaking. There you go.
Someone be quiet and give others a chance to ask some questions or make comments.
Yeah, how do I turn off my screen? I stop sharing my webcam. No, that's not.
Yeah.
I want to do that. Stop showing. Bingo. Got it. So my screen is off. There we go. Okay, screen is off. Okay, great. And I will just close that. There we go. Okay, go ahead.
See if anybody has some questions. I would agree with you, Dave, on most all the points you made, but we've agreed with each other on those points for the last 2 decades, mostly.
Yeah, well, we have to. Yeah, because we're smart guys.
Because we've used photic intensively, and we know what it can do.
Yeah, we're in the trenches, and we're also good at observing things, right?
Yeah. So the brain will, if you use photic consistently, the brain will slowly come around. If it's responding, like you say, you've got to check the physiology. But once it responds, you do it long enough, it starts to really entrain well and get better.
Yeah. It boots up, it reorganizes, and it gets functional. And it normalizes on a QEEG all by itself, even if you give it frequencies that have nothing to do with, like I'm doing here, SMR beta, and I'm establishing alpha. You know, and that works better than giving them alpha.
We noticed very well. We noticed that when you're doing neurofeedback, if you train SMR up, the SMR doesn't necessarily always go up, sometimes it goes down, but the rest of the frequencies begin to normalize. And I think it's the same thing with photic. You know, you're training one frequency, it's the other frequencies that are responding, and you have to watch those on your EEG.
Yes, you know, and like neurofeedback, we were very frequency based because that's all they knew about entrainment for 40 years after it was discovered in 1934. And then all these other things started showing up when they started improving imaging techniques, like the BOLD, the fMRIs, and all that stuff. And then we're like, holy, now it makes sense. We're doing all these other physiological systems that are affecting the frequencies. And like you discovered with SMR, neurofeedback, yeah, you're affecting other systems that that certainly the neurofeedback industry or profession is missing.
Yeah, it's fascinating, the idea that 16-second intervals, and they use 12 hertz, it looked like in that study.
Well, they used 4, 8, 12.
Oh, did they?
4, 8, 12, and 40. And you could see in the graphs there, 12, 8, and 40 did a little better than the 4, but the 4 is still 90% as good as the 8, 12, 40.
That's fascinating. That 16-second intervals stimulated glymphatic activity. That's amazing.
Other frequencies, other intervals did too, but it looks like it took 16 seconds for the maximal change in the dilating and the homeo and the baseline sort of the arteries were being affected. So it had the best result at 16 on and 16 off in terms of pumping action. But you could do shorter intervals or longer, which they did, and the result wasn't so good, or it was less effective. Like after 16, once you've dilated all those arteries from stimulation, after 16, it just sits there. And so if you go for 30 seconds, it's just going to sit there for 15 seconds and really do nothing. And so you're not going to get nearly as efficient a pumping action in a sense. You're only going to get 1 pump per minute rather than 2 pumps per minute if you do 30 seconds versus 15, let's say, right? And if they did, 10, they were only getting like 70% of the pumping action at 10 seconds. 5 seconds, they're only getting like 50% of the pumping action. So that's what they concluded that was most effective. Now we add sound to ours, and I don't know, we haven't done a study to see how much sound improves it, but I'm sure that sound is giving us even an enhanced effect again, right?
Yeah. Gary, you had a question?
Yes, Dave. I have a neurologist friend who was talking to me about cognitotherapeutics.
Yeah.
And how they did this super big study with all these dependent variables coming out great for doing gamma treatments for Alzheimer's. And he was very excited about this. And I said, oh yeah, I've got one of those in my drawer. that
yes, yes, indeed.
he's talking about getting it prescribed by physicians. What's up with that?
Yeah. I'm losing your. Can you guys hear me?
Yep.
Yes.
There's
Yeah.
breaks.
Okay.
Gary wanted to know what's up with that, you know?
Yeah, you bet. I'm trying to find out a way of seeing people. I don't know how to see people.
Oh, you can't unless they let you see them.
Okay. I just wanted to put people's audience view. Bingo. People can see me. Okay, I don't know. I don't know how it works.
I'm just here, Dave, so you can see me. At least you can see there's somebody in your audience. How's that?
Close enough. Yeah, close enough. Okay, good enough. Yeah, I just like seeing people and waving to them and stuff like that. But okay. So anyway, yeah. So anyway, I was going to mention. So I had this Parkinson's client after I got my sense of smell back, and he's been using normal entrainment for a long time. Typically, what we call the brain brightening protocol, which is SMR beta for a few minutes, and it drops to alpha, then back to SMR beta, and then back to alpha. So it goes back and forth. And he stopped the progression of his Alzheimer's and had reversed it some. Now, prior to going in, he had lost his sense of smell for 15 years, and he couldn't write at all. His writing was unreadable, and he had trouble walking. He had trouble typing, of course, and he's trying to run a business. And anyway, after I did it on myself, and in December, and I was like, whoa, this works so well. So I phoned him up and I said, get into my office. I got a machine for you to try and take home, and we'll put you on a pumping session. And so he's using the SMR pump every day, and I think 5 days a week. And a month later, he called to say that he smelled his wife's cooking for the first time in 15 years. And then he could smell perfume when they were at a shopping center. So they had perfume, I guess, counter. He could smell perfume. And then he smelled hot dog. He had a bunch of grandkids over having a birthday party, and he could smell the hot dogs. And he was so excited to smell hot dogs. And now he's smelling other things too. But he got all of his writing back. He can type again. And literally, I mean, he's motivated to get better. But he can now stand on one foot and put a sock on the other foot. I mean, most of us can't do that.
Yeah.
And so he's really made great strides since we put him on the pump. So that is sort of a study to show that entrainment on its own does work to some degree, but when we pump it, it really works. And his sleep is improved as well. So yeah, so he's very, very happy. And right now, John LeMay is doing all the visually evoked potential stuff. And I think he's got a half a dozen guys with Parkinson's right now who've shown dramatic improvements on the go-no-go VEPs after using the pumping session. So I think we're onto a pretty big discovery here.
Okay, Carly, do you still have a question? I see there's a question mark by your name.
I can't see anything. I can't figure out my menu.
Yes.
So I don't know what I'm looking at.
Okay, we got another question for you. Here you go.
I was curious if this technique has been shown to be effective for Lewy body dementia.
I don't know that yet. We are in such early stages of this. I can't tell you, but I can tell you that so many things affect cerebral spinal fluid. Nutritional deficiencies. Of course, we know sleep does already, but nutritional deficiencies, especially zinc. If you've got problems with your adrenals, your HPA-Axis, cerebral spinal fluid circulation gets impaired. I forget all the things I've been reading: strokes, aneurysms, stress, lots of stuff shuts down the circulation of cerebral spinal fluid. So we are just learning about all of this stuff right now, and it might well work. But we've not done it yet.
Mm-hmm. Thanks.
Okay, sorry, so I could give you a better answer.
No worries.
Any last questions for Dave before we sign off? We're almost at the top of the hour.
Sure.
I think we're good.
Thanks, Dave.
Yeah, thanks, Dave. Great presentation. Thank you so much.
Thank you very much for inviting me onto your lunch and learn. Appreciate it.
Good to have you back.
Yeah, good chatting with you too. You betcha. Good to hear from you.
Yeah.
We should
We'll
chat
get you
later
back
on.
down the road
Yeah.
again. You've always got something new and different going on, so we'll have you back again.
Okay, sounds good. Yeah, I'll be
We'll see
expanding
where
onto
this
this.
goes.
I'll be expanding onto this lecture as well because I'm learning more and more stuff all the time. So it'll be
Okay.
bigger. It'll be bigger in a while. It'll be probably more than the 50 minutes. But
Okay.
either which way, or maybe I can take other things up. Anyway, thanks so much again. Wish you guys a wonderful day.